Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. We are here today to help a patient with chronic back pain from his sacroiliac joint. This will be his left sacroiliac joint shot. And my goal here is to go in and basically destroy the pain nerves to the joint. Here. To do that, we're going to use a special wand called the Deuk plasma wand and go in and basically burn and cut those pain nerves so they never grow back again. Now, most of you have heard of a procedure called a radiofrequency ablation, and that's a treatment for pain nerves, same thing. But the problem with the RFA, or radiofrequency ablation, is that it doesn't work in many patients, and it doesn't last in many patients that it does work. All right, first thing I'm going to do is get down to the top nerve and try to destroy that. I've got to make my way up to that spot. Usually we can do everything with one incision. I'm going to try to do it with one incision. We'll see. But sometimes you have to make two incisions. Any questions?
No current questions, so in the meantime, why don't we show the audience...
Who's moving?
No.
Go ahead.
Let's just show the audience of how it is that we cure SI joint pain.
Yeah, I think that's great. Let's do that.
Perfect.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our video that we use our wand to go down and destroy these pain nerves to the SI joint, and that's how we get pain relief in the SI joint. Now, alternative treatments include fusion of the SI joint, but it turns out fusion doesn't work. They did a study out of Norway recently that shows that fusion of the SI joint patients don't get any better with the procedure, Sean, and that they continue to have problems with pain in their SI joint. So we've done fusions ourselves and we had not really good results, so we stopped doing them. And we converted to just doing the rhizotomies of the SI joint, like this patient here. Now, this patient has been here before. This is his third visit to us. Sean? And he's been here before because we treated other things that cause pain for him. And he actually has decided to break up his treatment into multiple treatments. So that's why we're here today.
We
You have a question?
Yes, we have a few questions. First one is coming from Ramazan on YouTube,
Hi, Ramazan.
saying, "Hi, Dr. Duke. What is different bone scan? Yeah, the difference between bone scan and MRI for the neck. MRI showing C5, 6, 7, canal narrowing, and disc bulge, but bone scan shows nothing. Are you asking bone scan before any treatment or only MRI? Thank you."
Yeah, thank you. So the question comes from one of our viewers saying, you know, Dr. Duke, when you're trying to figure out what's causing somebody's symptoms in their neck, do you get an MRI? Do you get a bone scan? Do you do both? I get an X-ray and an MRI. Bone scan is 100% useless. Bone scan is only used for if you suspect an infection or a tumor or a fracture. Infection, tumor, fracture. That's it. So otherwise, I don't get a bone scan. It's useless. Remember, folks, these diagnostic tests, MRI, X-ray, CAT scan, bone scan, whatever test you're talking about, it does not tell you where your symptoms are coming from. It never will. You need an experienced surgeon to tell you exactly where your pain's coming from. And the only one that I know of in the world is at Deuk Spine Institute. Okay? Why? Because we have literally figured out where everybody's pain's coming from through our patients, through thousands and thousands of patients we've treated successfully to cure their pain. We now know all the causes of pain and symptoms, and we know how to identify them. And it's not through a MRI, X-ray, CAT scan, or bone scan. It's through physical exam, okay? Combined with diagnostic imaging. You need both. And it's called the Deuk Spine Exam. Next question.
Question coming from Lanu on YouTube, asking, "How small are pain nerves?"
Very small. They're sub-millimeter. They're called type 4 fibers or C fibers, and they are unmyelinated, generally unmyelinated. They have no myelin sheath, and they basically are very small. No, not yet. All right. Any more questions?
Yes, we have a question coming from, I love this name, Lioness Blessings on YouTube,
No.
asking, "What test is best to show SI sustained?"
Mm-hmm. Yeah, there is no test to show the SI joint is the source of pain. It's there is a block you can do where you inject medicine in the SI joint, and the patient will get relief. But that's the only quote-unquote test. It's not a diagnostic imaging test. It's a functional test, a physiological test. But it's really a clinical diagnosis that I make through the physical exam. All right, thanks for joining us. We're going to end the broadcast. We'll be back in 2 minutes for another stream on a piriformis muscle release. Thank you.